The treatment of hip arthritis begins with non-surgical treatment. Generally this entails activity modification, gentle stretching of the hip, gentle strengthening as well, these exercises. But big thing is avoiding the high impact type activities that clearly aggravate the pain. Once this has been tried and ineffective, then medications are the next step. We encourage people to start with Tylenol or acetaminophen. It's usually the lowest risk type medication to be taking. Being very careful not to avoid the maximum daily dose or stay under the maximum daily dose, as it can hurt the liver. Non-steroidal anti-inflammatory drugs are then the next option, and these can be taken with Tylenol at the same time together, as they are different medications, and taking an anti-inflammatory with Tylenol can be quite effective as a pain reliever. Generally, we encourage people to start with over-the-counter medications. Ibuprofen and naproxen are the more commonly sold over-the-counter. And being careful of the side effects of these drugs as well, particularly ulcer risk in the stomach or duodenum, and general stomach upset. So being careful to watch for blood in the stool is important. There are prescription anti-inflammatories that can be stronger, and this would be another reasonable step after the over-the-counter medications have not worked. Cortisone can be injected in the joint as well. Cortisone is a steroid, it's an anti-inflammatory, and when injected in the joint in high concentrations, it can reduce inflammation like the anti-inflammatory ibuprofen or naproxen that is taken systemically. This is focused on the joint, the problematic joint, and can be effective as a short-term way of dealing with the pain. Finally, surgery. Once non-surgical methods are clearly not working, then surgery would be the next potential option. Considerations before surgery is recommended are the severity of the arthritis, the length of time. Generally, we don't recommend surgery for people who have had pain for less than 3-4 months. We'd like people to be sure that non-surgical methods have not been effective. Surgery exposes you to more risk than non-surgical treatment, and so it's important to utilize all the non-surgical methods before making the step to surgical treatment. So length of time with pain is important. Age of the patient, we don't want to be replacing hips of young people. You have longer to live, and these implants have a finite lifespan depending on how well they're treated, and so the less time you have them in your body, the better. So age, severity of the arthritis then as well, and the amount of handicap it's creating in your lifestyle. And this is a lifestyle decision. We're basically treating pain that is affecting lifestyle and affecting your ability to remain active. Surgical options for arthritis. Generally, hip replacement is felt to be the best option for advanced arthritis. The considerations when determining when it is determined that hip replacement is the best option are choice of approach, how to get to the hip. I use an anterior or front approach to the hip. I've been using it now for many years. I started using it to reduce the dislocation risk, but I find it works well for me in getting things the way I want them, getting the implants in properly, and doing the least amount of trauma to the muscles and soft tissues around the joint. There are other options of approach to use to the hip, and all have their pros and cons. Most importantly is what the surgeon is comfortable with, and the approach that they use that minimizes their chances of a problem afterwards. Next consideration is implants to use. There are hundreds of implants that we have to choose from. The current implants that I use now and that I feel are the state of the art are uncemented implants for both the stem and shell of the hip. These work well for me. I've been using them now for many years, and they have a reproducible effect for me, so I feel the most comfortable with them, and they have a long track record now that I'm comfortable with. They're put in initially with a friction fit, and then over time your bone fixes them permanently. And once they're fixed permanently, as long as they're monitored, they should stay fixed permanently, unless you have bone loss for other reasons. bearing choice is a big decision in hip replacement. There is a lot of evolution in this area, and some controversy as well as new implants come on the market and are tested for shorter periods of time. We find that most implants work very well short term. It's the medium and long term results that are important for us to determine what's best to be using. Generally, the gold standard still remains a metal femoral head with a plastic liner made of a highly cross-linked polyethylene. This has been used for the longest. It has the longest track record and a very good track record. Ceramic on polyethylene is another very good option that's been around for many decades and continues to evolve in terms of the strength of the ceramic that's used and the quality and wear resistance of the polyethylene. Metal on metal is another option. It has had mixed results over the years and is something we continue to look at and evaluate critically, and I think time will tell if it truly becomes as good a bearing as we would like it to be.